So liver cancer is really two diseases. It's a malignancy and carries all the anatomic problems that having cancer come with, metastases or obstructing bile ducts or causing pain. But it also carries the risk of progressing of their cirrhosis, an underlying liver disease. And the two will play off each other. That is the tumor and the cirrhosis and liver function. And therefore, having a team that has a lot of experience in the management of patients like this is critical. There are a lot of key players in the management of patients with liver cancer. One would be a hepatobiliary surgeon or transplant surgeon, given the importance of that modality of treatment in curing patients. Diagnostic and interventional radiology play a very important role in imaging and liver-directed therapies. Hepatology plays a pivotal role, or gastroenterology, in managing complications of liver disease, assessing for risk of decompensation with procedures. And then a medical oncologist to help manage systemic treatments and supportive care for a patient with cancer. This patient is presenting with several characteristics that would preclude liver transplant. Liver transplant has evolved over the past 20 years and is now broadly accepted as a curative modality for liver cancer. But the critical aspect that will determine if a patient is curable is really the size of their tumor and tumor characteristics going into transplant. Initially, the Milan criteria was used to establish the optimal patient for transplant, and that was 3 tumors up to 3 centimeters, or 1 tumor up to 5 centimeters, and these tumors could not have any evidence of vascular invasion. Over time, it's been identified that that might be a little too restrictive, and in the past several years, there's been a movement to go up to larger tumor burdens, and this is somewhat regional, whereas Milan criteria is broadly accepted. The so-called UCSF criteria is not as broadly accepted, but many places do accept that, and that takes a total tumor burden up to 8 centimeters, individual tumors up to 6.5 centimeters, and up to 3 tumors as long as none of them are greater than 4.5 centimeters. Even with the broader criteria in this case of UCSF, this patient is beyond criteria. They have vascular invasion, which uniformly precludes transplant. Also, they have a single tumor, which is infiltrative. That is a sign of an advanced tumor that, again, is beyond all criteria, let alone the satellite lesions they mentioned.